So the rotator cuff is a group of 4 muscles and tendons that encircle your shoulder joint. They are extremely important muscles for the function, so they allow the shoulder to move in different directions, and they are also very important for the stability of the shoulder. An injury to one of these structures can make your shoulder quite painful and can also cause instability, for example, a tendency to dislocate your shoulder, especially in older patients. So the rotator cuff tears or rotator cuff injury can be either due to a significant trauma, for example, when you have had a significant fall, or it can simply be due to wear and tear. When rotator cuff injury occurs due to a significant fall, most patients would experience severe pain that may or may not improve in a few weeks' time. But on top of that, they would experience quite a lot of weakness and loss of range of motion. And in that scenario, it is really important that you seek early medical advice. If your shoulder pain has developed over time, then it can still be a rotator cuff tear due to wear and tear. And in this scenario, it is not that easy to differentiate this pain from other causes of shoulder pain. But if there is any weakness, then there is high likelihood that there is a rotator cuff injury and there could be a significant tear. So again, in that scenario, we would recommend that you seek medical advice. So if you have had significant trauma, for example, you have fallen even from a standing height, but you have a lot of pain in the shoulder, the movement is lacking, and the shoulder in general feels weak, then I would recommend an early review by a doctor, ideally a specialist in shoulder surgery. And that by early, I mean that it should be within 2 to 3 weeks after the injury, or even earlier if possible. If your shoulder pain has been there for a while, for weeks or months, and there is no history of trauma, then it is entirely reasonable to initially see a physiotherapist or an osteopath who then can work on your muscles, work on strengthening of the shoulder. If that does not relieve your pain, then you can see, then you should see a specialist for a scan, either an MRI or an ultrasound scan, and then have appropriate treatment from there on. But it is reasonable to have therapy with an osteopath or a physiotherapist before you see a specialist in that scenario. So it is really important that you keep your shoulder as mobile as possible, because lack of movement will make it stiff and can make you prone to develop a frozen shoulder. A frozen shoulder takes a long time to recover, and it is best prevented rather than treated. Heavy exercise should be avoided, especially if it is causing you significant pain. Mild discomfort is acceptable, but it's important to at least keep moving the shoulder through a pain-free range of motion. And again, a physiotherapist or an osteopath or a sports massage therapist would be able to guide you through light exercises in case of an injury or pain. So again, this depends on whether this is a tear due to trauma or this is a tear from normal wear and tear. If the tear is due to trauma, then it's more likely that you will require further treatment, such as keyhole repair of the rotator cuff. But even in case of trauma, sometimes the tears are not full thickness. They have only gone through half or partial thickness of the tendon. And in that scenario, you can either be treated with physiotherapy or even a steroid injection. In the second case, when the rotator cuff tear is because of normal wear and tear, then it's always preferable to at least try physiotherapy and potentially a steroid injection, as long as the tear is small. But here also you would be guided by your specialist, and almost always if there is a large tear with noticeable weakness in the shoulder, we would recommend surgical treatment. But if it is a small tear and it is not too painful, then we would refer you on for rehabilitation in the first instance.